We the students of Government Medical College Karur here to present a topic on Bell's palsy. So Bell's palsy is a lesion, is a problem where the lower motor neuron is affected. So this is the cortex, this is the pons, and from the pons facial nerve is originating. Facial nerve is affected here. So this is the upper motor neuron from the cortex to the pons, and from pons to the face we have the lower motor neuron. This we can see is the normal side, and this is the abnormal side where there is a lesion present. So now if we see for the causes of Bell's palsy, there is the sudden exposure to cold, and there will be middle ear disease because the facial canal is present in the middle ear, where any middle ear infection can affect the facial canal, and the tumors of the parotid gland because facial nerve comes into the parotid gland and terminates into 5 branches. So if there is any tumor, it will be affected, and demyelination within pons because the facial nerve is originating within the pons. And if we go for the clinical features, on the affected side there will be no wrinkles and they cannot be closing the eyelids because there will be orbicularis oculi muscle is affected, and due to that unclosure of eyelids there will be keratinization present and there will be any infections also seen, and nasolabial fold is absent on the affected side, and deviation of the mouth will be present on the normal side because of the lateral pterygoid which is pulling the muscle, pulling the angle of the mouth. And if we go for the additional features, since the facial nerve is a mixed nerve, we have the sensory component and the motor component. Sensory component is the nervous intermediate. So there, if it is affected, there will be loss of salivation and lacrimation on the affected side. And the nerve to stapedius is a branch of facial nerve on the middle ear cavity, and it is supplying the muscle stapedius. So if that nerve is affected, there will be hyperacusis. That means a small sound itself will be heard as a loud noise. And the cauda tympani nerve is again a branch of facial nerve, where it is joining the facial nerve in the facial canal, and if it is affected, it will be there will be loss of taste sensation on the anterior two-third of the tongue. And geniculate ganglion is the ganglion present on the first bend of the facial nerve in its course. So if there is any lesion over there, there will be lacrimation, salivation loss on the affected side. And if we go for the recovery there is complete and incomplete. Complete there will be neuropraxia, and incomplete is the Valerian degeneration. So neuropraxia means there will be the peripheral neurons will be affected, which can be recovered within 2 to 3 weeks. And incomplete there is Valerian degeneration, and Valerian degeneration means there will be the complete denervation of the neurons, so they cannot be recovered. And if the nervous intermediate is affected, it should be joining with cauda tympani during regeneration. That means while having food there will be salivation present, and if it is joining with the greater petrosal nerve there will be lacrimation while having food, that is called as crocodile tears or the Bogart syndrome. And these are the celebrities who got affected and cured by the Bell's palsy. Thank you.